Good afternoon, friends. This is Somu from DC, and we are honored to have our Honorable Minister for Health, Home, Power, and PWD and Industries in Government of Delhi, Mr. Satyendra Jain. He is one of the high-performing, on-the-clock working ministers, and is easily one of the best health minister of any state in India, who is setting a very high standard of providing good health care to the poorest and the underserving sections of our society. He is known to be very active doing surprise visits in late night and early morning in hospitals to ensure that the good service is provided to all the people who come to the clinics and hospitals. One of his much acclaimed initiatives, the Mohalla clinics, got high praises in both international and national media. A Washington Post column even recently suggested that American public health services should consider adopting the Delhi Mohalla clinic model. So there is so much that we can learn from the work of Health Ministry and from Mr. Jain. So without much delay, I'm going to have Minister tell us briefly about some of the initiatives that is currently happening, what happened in the last 1 year, and what are some of the plans that Sir has for the future in the health ministry and also in some of the other ministries that he works. And after that, we will have a quick Q&A. So now I'll ask Sir to speak.
First of all, good morning to everybody. Let me correct one thing. We are doing making health services for everyone, every citizen of Delhi, not only for the lower sector of the society, but for every citizen. We are concerned about the health facilities which are at present provided. We are opening 1,000 Mohalla clinic, and the target is this year, 31st December. Already we have started 100 such clinics in Delhi. 3 are permanent structures, and 97 we have on rent basis. They are on trials. We are just doing our pilot studies. We are strengthening our processes. In the next 2-3 months, all the processes will be strengthened and streamlined. Then we will start our next lot of Mohalla clinic. Every month, maybe 100, 200. And the target is by the end of this year, we will start all the Mohalla clinics. Concept is very simple. There will be a doctor. We will give consultation to all the patients. Then investigation. There will be 50 investigations on the site and 212 investigations off site. We will take the samples, and the test will be done in the laboratories, and the report will come in the evening or the next day. And there will be medications. All services will be free of cost to all members. But right now, our experience, I would like to share that the first Mohalla clinic we opened 7-8 months ago. We thought that we will be able to treat 80% of people there, and the rest 20% they will be referred to the higher facilities. But to our surprise, 95% people were treated there, and only 5% people required the referral. And one more thing is, after opening these 100 clinics, most of the visitors are ladies. 80% of the visitors to the Mohalla clinic are ladies or children. And this is a very unexpected thing. We were not expecting this thing. Generally in Delhi government health facilities, the number of male are more than the female. But in the Mohalla clinics, this is a very good sign. And we got the depth of this and came to know that normally ladies avoid visiting the physician. If they have any problem, they will take their children to the doctor, their husbands to the doctor, but avoid themselves, and because they don't want to spend on their health. For us, if ladies are healthy, the full family will be healthy. Children and ladies, they will be healthy, then the whole family will be healthy. Our next layer of health facility will be the polyclinics. Our target is to open 100 polyclinics in Delhi, and there will be 5-6 consulting doctors, X-ray, ultrasound, ECG, and all the tests required. And first people, those who are not treated, may not be treated in the Mohalla clinic, may be referred to the polyclinics. Then we are opening 50 daycare hospitals. In the daycare hospital, small general procedures. If you come in the morning and by the evening you go to your home, and the hospital will be running only in daytime. It will be a small hospital, and the general procedures will be done there. Then we will have our secondary and tertiary care hospitals. That will be 40 to 50 hospitals, and our target is to double our bed strength by 31st December 2017. Right now we are having only 10,000 beds in Delhi government hospitals, and we will increase the bed strength to 20,000 in next 20 months. And we will standardize all the hospitals. The existing hospital will be renovated, and we are coming up with few new hospitals also. The aim is to make there is only one class of facilities. There will be only general wards. All hospitals will be efficient. All basic facilities will be there, but there will be no VIP rooms in any hospital. If a person from the lowest strata of the society comes or the highest strata, everyone will be given the same treatment. Because in government facilities, if we give preferential treatment to someone, say private rooms or suites, etc., that will be very costly for us. In the same finances, we can handle 5 to 10 beds very easily. And moreover, we are coming with health insurance policy also for all citizens of Delhi. We are computerizing our own health system. There will be very advanced health management system. Our target is there should not be any pen or paper in the hospital or any facility, the Mohalla clinic, polyclinic, hospitals. Everything will be computerized, and we have just started in our Mohalla clinics using tabs, and this is the first phase of implementation of that computerization. And we are coming with a health card for our population. Every data of every citizen will be stored on cloud and access to the health card. The data will be the property of the citizen, not the government or someone else or the private hospital. They can access anytime, and if they go to any health facility or doctor, they will be allowed to access their health data. And one more thing is, these are the things people are coming to us, but our target is not only if, we are working for the people those who are coming to our health facilities. Our liability is to go to the people those who are not coming to our facilities. We have done a pilot project in eye care. We started a health van and run for 2-3 months. It was a strange finding. Daily, initially the van was going in the slum areas, and we started checking the eyesight of adult population above 40 years. More than 50% of population was in need of spectacles. We provided them spectacles on the site, and roughly 5% were needed that cataract surgery. That was a huge number. And then we tried in a posh area also, and that was an eye opener for us. In the posh area, the statistics were the same. Many people were requiring spectacles and cataract surgery. So then our aim is to outreach to all people of the society for, say, eyes, ears, high blood pressure, diabetes. Delhi is having so many people with diabetes and hypertension. That is a very grave concern for government, and we will outreach each and every person of the society. And our one more target is child health. We will concentrate on all children before birth and up to 5 years of age, so that we can give them all facilities in healthcare, and that will save our money in the future also, and they can be a better citizen. In the health sector, our targets are now very, very ambitious. Some people are saying that they are too ambitious, and I say, if you aim for the moon, I think you will reach also. And we are confident that all these things that we are saying, most of the things will be completed by 31st December 2017. Our targets are not 7 years or 10 years or 8 years. Most of the targets are well within 2 years. In Public Works Department, we have made, in Public Works Department, we have completed a few elevated roads, and in 3 sections, we saved 450 crore rupees. And how we saved is we completed projects well within time. And in Delhi or in India, most of the projects are delayed by 5 years, 10 years, 7 years, 8 years. But we are monitoring the project day to day basis, and we are able to complete the projects in time. This is a major thing. That's why we save money, and that the money we save, we pump in the health sector. Now we are giving free medicine to all residents of Delhi in all government facilities from 1st of February. And that is a very good impact on our people. The consumption of medicine is now double the initial consumption. Medicines are consumed double in our hospitals. And we are redesigning our Delhi roads also. 11 roads that are under redesign, because in Delhi, now the roads are designed mainly for cars. But criteria we have changed is, first priority will be the footpath for walking, second will be cycling, third will be public transportation, and then will be the cars, private cars. Delhi roads are not safe for walking right now. We are trying to make them walking friendly and cycling friendly. And for pilot projects, we are chosen 11 stretches, and very soon we will start working on them. We are starting vacuum cleaning of Delhi roads, already started, but that will be full scale within 2 months. And Delhi has 1,270 kilometers of stretches with Public Works Department, and all roads will be vacuum cleaned. We are planting trees on central verge and side of the roads so that there will be no dust. We are trying to protect our environment as far as possible, and odd even is one of them. In power sector, Delhi only city or only state where power tariff is not increased in the last 1 year, more than 1 year. Some states have increased 20%, 30%, 15%, and now Delhi is the third cheapest state in power for the domestic sector. The 2 other states are only Goa, that is a very small state, and Himachal Pradesh. In industries, we are coming up with a few very mega projects so that IT, hardware, software, and high-tech industries will be invited in Delhi, and we will invite all industries, all from all over the world, come to Delhi and set up their facilities. For the last 15 or 20 years, no facility is added in Delhi, and no one can set up their facilities in Delhi. They have to go to Noida, Greater Noida, Gurgaon, Bangalore. But in Delhi, there is no space. We are coming with few spaces, and I think within 2 years or 2.5 years, we will be able to invite people to come to Delhi for these things.